Masroor Ahmed, CEO of Symetria Recovery. Thanks for being here. Appreciate it.
Thanks for having me.
Yeah, of course. So I want to get into Symetria. I want to talk a little bit about opioid addiction in general. But first, because this is CEOs You Should Know Chicago, I want to get into you a little bit. I want to talk about you because that's kind of the point of this discussion, is not just to dig into the companies, but also the people who are running them, the people driving the economy here in Chicago. So today, that's you. So first of all, U of I grad, yeah?
Yeah.
All right.
Graduated 03, U of I.
Nice. Got to shout out the local connection. Love that. And so looking at your sort of career journey, I noticed a few things I want to point out. I saw CRM tech.
Yep.
Saw company benefits tools.
Yep.
And then meal plans.
Yep.
So I would say the road to opioid addiction treatment centers was more of a long and winding road than a predictable path.
I think it's cliche to talk about winding roads, but this is like over the top. How did this guy end up doing this thing? I think the way I've sort of thought about it is really doing interesting and challenging work with smart people. And I think the thread, you're talking about the industries I've been in, but the thread through all of that is getting to work with outstanding people. And I could probably spend a whole kind of why I worked at Factor or Jellyvision, those places. They're just incredibly talented people, just doing really cool stuff.
Okay.
Yeah.
So clearly drawn to interesting companies, interesting industries, but also critical that you work with great people, which tracks, makes total sense.
Yeah, and I think some people think about careers as, and there's nothing wrong. Like if you have a specific life mission, you're spending your life in an industry or a function, that's great. That you get really deep in one area. That's not necessarily my cup of tea. I read a lot of variety of things. I have vast variety of interests. And I think my career reflects just finding stuff that's super different and challenging.
Okay. So you're at Symetria now for 6 years.
Yep.
You are the CEO. SymetriaRecovery.com, by the way.
That's right.
And I think since it's an opioid addiction treatment center, and I know you treat for other things too, but I think it's important to maybe set the table a little bit and talk about sort of where our country is with opioid addiction, how it got there, and how it created a space for a recovery center like Symetria. So, and you tell me if I get any of this wrong, but based on what I could find, you've got the 90s, right, where medication is being legally and heavily marketed.
Correct.
And yet there was claims that none of it was really addictive.
Correct.
Fast forward a decade maybe, and you find out it is. The government steps in.
Huge lawsuits, all that kind of stuff.
All that.
Yeah. And down, not just, pharma takes a big bad rap for this, but up and down the prescribing, the pickups, the retail pharmacies. There's a lot of hands, unfortunately, in what happened in the 80s and 90s.
Yes. And as things change, government intervention, people, they lose access essentially to a lot of that medication. But at this point, they're in the throes of addiction. And so they find other ways to get whatever they need in the form of maybe synthetics, maybe heroin. Yeah. And then now what you have is, from what I read from CDC and from the Substance Abuse Mental Health Service Administration, you've got about 8 million people, 12 plus, who are misusing opioids annually.
Correct.
Of those, 5 million have substance use disorder. Right?
Yeah. So the way you that's roughly right. The way I would frame it is at the center of what we do is opioid to fight sort of opioid addiction. The concentric circle outside of that is broad substance use. So think about alcohol, other narcotics, cocaine, all that kind of stuff. So generally, your number's right. We've heard kind of 5 to 9 million in terms of opioid addiction. Okay. When you look at the broader substance use disorder, that could be, and again, numbers are hard to get at, but 40 to 50 million Americans, we're not talking global, 40 to 50 Americans suffer with some type of substance use disorder. Okay. And we sort of operate in that world with opioid at the center of it.
Got it. And one thing I found interesting, and this will get me to Symetria, is that of that now this is just opioid though.
Yeah, sure.
About those 5 million, only 17% were getting it treated with medication, which
Correct.
means there's tons of people out there that are suffering
100%.
and not getting the help they need, which is clearly there's a market here. And I know it's, again, not to sound insensitive, it's not about business necessarily, but like there's people that need help. Symetria provides that help.
Correct.
Right. This is sort of where you come in. So
putting Symetria aside for a second, it's worth taking a beat on our industry. So, when the problem became more acute and people became more aware, you have what is traditionally known as inpatient recovery. So this is what most people think of when they think of recovery. Hey, I have a problem, however, whatever substance that problem is, I'm going to go eject out of my life. I'm going to go somewhere for 30 to 60 days, and I'm going to go on my recovery journey. That might be counseling, that might be a whole host of things, psychiatry, but critically, I'm exiting out of my life. And then the hope and aspiration is that when I come back, I've addressed what the core causes are. If I have, pharmacological challenges like medication, whatever it might be, and then I'm going to come back to life. I think the challenge that we saw is, in particular in the 90s and early 2000s, is that works for some people, but not all people. And so the outgrowth of that is, okay, well, that's, first of all, it's incredibly difficult. And to eject yourself out of life and say, hey, I'm just going to put my life on pause. I'm a parent. I'm 20, I'm 40, I'm 60. It's not easy. It's not for everyone. And then the second, so as a result of that, you have sort of, long-standing, homegrown AA, NA places where people find in their community organic places to go find support and help. That also works. All of this is helpful for the right person, but incredibly difficult to do and has its own sets of challenges.
Okay, yeah, because I was looking into the company, and I know there's one thing you sort of run counter to is this sort of all or nothing approach to treatment, right?
Yes.
That's kind of where you were going with that?
Yes, yeah.
Okay.
I mean, a lot of places to go with this. I would say, part of, for Symetria, I would say just thinking about sort of that historical model, either inpatient or traditional ANA, we sit squarely in the middle where there's a critical importance to actually staying in your personal life, meaning keeping your job, taking care of your kids. Let's just assume I'm a mid-40s guy, I have a job, I got a life, I got bills to pay, but I need counseling, I need psychiatry, I need potentially medication that I need to take regularly to support me because I have a true chemical imbalance. I think some of this comes at the heart of what is addiction. And are we really talking about a moral challenge, an emotional thing that has to be dealt with? Yes, partially, that there are deep things that people have to work through. But secondarily and more critically, in terms of 20% of people with opioid recovery actually getting help, there's something physical happening when someone goes through addiction. The chemical imbalance in their body, people are having real withdrawal. It's not in their mind. It is physical. It's biochemistry. And supporting somebody through that in an outpatient setting, at least over the last 10, 15 years, has proved to be, both sort of more amenable for the person that, hey, I can still keep my regular life and go get the support I need, but also just more realistic. They can, it's more affordable, more, I don't have to disrupt my entire life.
And to your point, it's, to be fair to that, it's not a breakdown of willpower and morals. You're not a horrible person.
100%.
You have a problem. And you guys recognize that. I think the stat people say is about 20% of people with opioid recovery are actually getting the support they need. Well, what are the other 80% doing? And why aren't they getting? I mean, the heart of this comes to, it does feel like a moral failure. We spent a lot of time, and folks in the industry, trying to get over the stigma of coming for help and getting help. I think as a country and as a culture, we've done a great job over the last 10 years recognizing mental health in that way. That's great. But I don't think that we've made the same headway in substance use disorder. If you talk about 40 to 50 million Americans, I mean, that's 10% of American adults, or just Americans sort of broadly. And so, I mean, the way I talk to people about it is, if you don't know somebody with opioid addiction or substance use disorder, you just don't know that they have it. These people are in your lives suffering with substance use disorder. It's there. Yeah.
It's there.
So you have 6 locations in the Chicagoland area, correct?
Yeah. So Chicago is where we started. Our first, for the Chicagoans, our first clinic was in Naperville, 6 locations across Chicagoland.
Okay. And I wanted to just touch on something I saw on your About Us page, because I think when people want to check out a website, symetriarecovery.com.
Yeah.
They often want to go to the About Us page, and you say something in there that really hit me, and I love it. And one of the first thing you read, it says, "We will never give up on you."
Yeah.
And I think that's a really lovely sentiment. And I just wanted you to maybe speak a little bit about how that reflects your approach to care.
Yeah, 100%. It really comes back to, you touched on this a minute ago, as sort of the all or nothing approach. So even going back to the historic of, how substance use disorder and opioid recovery is normally, it's thought about as very binary. Hey, you have substance use disorder, we will fix it, and now you no longer have it. The truth of the matter is, as anybody who's been through the journey or witnessed the journey, it is a journey. And people are on a sliding scale of suffering with substance use disorder. The never give up on you, and really letting the patient set the goal. So we get folks, for example, who say, look, this alcoholism is taking over my life. I'm drinking every day. I don't know how this happened, COVID, et cetera, et cetera. We can talk about the culture shift and all that kind of stuff. And they're not saying they want to go sober. They're saying, hey, I just want to be normal. I just want to drink on Saturday. That's okay. I got buddies, I got family. I can't cut it out of my life, but I need to drink less. I need to get my life back in order. That seems natural and intuitive, but folks in recovery in traditional spaces, it's like, well, what do we do with that?
I'm really glad you brought it up.
Yeah.
Because it's in a lot of your reading materials. And growing up the way I did, it's when you hear addiction, it's eradicate.
Yeah, 100%.
That's the only way to talk about it, to discuss it, to fix it.
Yeah.
And you guys aren't saying that.
Yeah.
You're saying there's a way to potentially just to improve it little by little, but live with it.
Yeah. I think this really is at the heart of patient-centered care. A lot of folks will say, hey, I'm going to tell you what your goals are, Adam. Mm-hmm. This is what success looks like. The approach is actually totally different. It's, hey, Adam, it's your first day. What are you trying to get out of this? And actually listening to you and allowing you to set the goal that, like, okay, no, maybe I do want to get to this place where I'm completely abstinent. Awesome. We're here to help you. But you know what? If it's going to take me 9 months, I'm going to need the 9 months. Awesome, Adam. We're here for you. We're going to take you on that journey. And I think the other element that a lot of people, especially the sort of goal setting, it's a little bit arrogant if you think about, from the care model for me as your physician to say, I know what you want, and this is where I'm going to take you, versus saying, hey, I'm going to help you, and I'm going to take you to where you want to go. In general, that person gets there on their own, and that's lasting recovery. There's a big difference with me telling you, hey, these are the rules, this is what you have to follow, and if you don't follow them, hey, you don't fit in, we're not going to give up on you. You're going to set the goals, and we're going to help take you to your goals.
I see you, I'm going to meet you where you are.
100%.
Right? Okay. It's interesting. It's when you talk about working with them on goals, which again it was never my perception of how addiction is treated, but it almost sounds like financial planning.
Yeah, it's so funny.
Like you're the individual.
Yeah.
Let's figure out your goals.
Yeah.
And let's build a plan.
Yeah, 100%. And I think one of the things that, there's a term in the industry called harm reduction. And I'm even kind of, apprehensive to bring it up, but I think it's important to think about it, because in the end, it's really about what is the outcome, what leads to the best outcome, what is going to save the patient's life. Like, we have to start from the baseline. This person is at risk of death. Let's be very honest about what's happening. ER visits, multiple ER visits a year, incredibly burdensome on the health. Whatever angle you want to take, it's incredibly burdensome on the healthcare industry, on Medicare, Medicaid, all that kind of stuff. And they're at risk for death. And so taking someone, allowing them to set their goals, what happens naturally is illicit drug usage goes down. They have vastly improved their longevity through that process. Whether we set the goal or they set the goal, what we see in our data across our patient population is vast decrease, especially in the first 90 days, of illicit drug usage going down.
Okay. And can you kind of give an idea of, maybe by percentage, what most people come to see you for? Is it opioid or is it? Historically, we started as an opioid recovery program. I would say today
For Symetria, about 75-80% of our patients are struggling with opioid addiction. The other significant portion, particularly coming out of COVID, has been alcohol use disorder. I think there's a vibe shift happening in our culture, in our American culture. I think that it's hard to recognize alcohol use disorder.
Why?
It's so accepted in our culture that we don't know what it looks like, both as a person who might be drinking too much and what that feels like, because it feels that, well, all my friends are drinking a couple times a week, and hey, this is our work culture. I think coming out of COVID was incredibly isolating, and any sort of normative corrections that might have happened, like a buddy pointing you aside, be like, hey man, is everything okay? That didn't happen for a few years. And I think people are now shifting. I think coming out of COVID, I think there's the resurgent focus on health, realizing that alcohol is a very significant thing in Western culture that's sort of at the heart of a lot of our health crisis. Yeah. So there's a shift happening, and we're paying attention to it, and we certainly feel it. There's a lot of folks in our IOP program is kind of intensive outpatient, where they're coming in several hours a week. We have a growing population of alcohol use disorder, and we're here to help.
Okay, and again, the program, it's all outpatient.
Yep.
Right, and then. But you're saying it varies how many days a week someone might be coming in. Again, that's based on the individual. That's based on the plan.
100%. So the way the way we think about, we've defined and sort of coined a term called the Symetria method, and our approach in outpatient. And speaking very simplistically, just because people talk about outpatient doesn't mean it's like low touch. The real question is, how can you deliver high quality care without having the person go inpatient for 30 days or 60 days? And so we really think about, again, at the patient at the center, what does that patient need? Some folks need a heavy individual counseling. Others, they want to spend time with the psychiatrist because there's something underlying they've been struggling with for years that they've never had the opportunity to work out, that mental health is an adjacent to substance use disorder. They've never had the opportunity to work it out. Other times it's medication. There is medication particularly in opioid recovery, that can help with the withdrawals, can help get over and help kind of keep you in your life. And so we really want to offer that, back to your question, in an outpatient setting. So there's some folks who come in and spend a few hours in our clinic. Okay. There are others who are coming in a couple times a week for 10 minutes and checking out, meeting a nurse and taking some medication.
But I think it's important to point out that you're not, you go to a doctor, normal circumstances, right? You go to a doctor, and then maybe you need therapy, and then you go to a different therapist somewhere else.
Yep.
And then you got to go to a pharmacy somewhere.
Exactly.
What you're offering sounds incredibly convenient.
100%.
Patient focused.
Yeah. I mean, our approach, particularly, there's a few things historically that have happened in our industry where people, companies have been, bifurcated. Hey, we do therapy. We do the medication part. We do the psychiatry part. And, we've been at, Symetria has been in Chicago for almost 20 years, but really been growing the last 10 or so. We started in Naperville, and now, we were the first. Back 10 years ago, it was crazy to say, hey, we're going to do IOP. We actually have psychiatry on staff. That was unheard of. You're seeing more folks do it today, but we've, from the beginning, sort of really started with this integrated approach in an outpatient setting.
Got it. And so I did want to touch real quick. You also have locations in Texas.
Yes. Yes.
If we're going to leave Chicago for 2 seconds and talk about Texas.
Two of my favorite states. Yeah. So we've been growing in Texas. We now have 9 locations as of last month. I talk about Symetria as really a 3-city company. We're in Houston, Dallas, Chicago. The work we do, there's a tangent here. There's a lot of folks doing telehealth, and that's great to see. I mean, the problem is so massive that, coming out of COVID, there's a lot of telehealth businesses, and that's great. I generally think the problem is so significant. There are no competitors in our industry. It's what do the people need, and let's go serve people. And in Texas, there's just been a lack of in-person recovery location. You can just look at general, hey, how many places are offering opioid treatment programs in Texas compared to how big the population is. And what we found is in Houston and Dallas, there's been just a thirst for what we're doing. Yeah. And the last couple of years, we've been really focused on opening our locations down there to great success.
That's great. Are you targeting additional markets? Do you hope to go national someday?
We are. I mean, I think about it as measure twice, cut once in how you think about this work. we don't want to get ahead of our skis. And so we've been very deliberate. We've opened, 1 or 2 a year the last couple of years as we've been expanding outside of Chicago. We absolutely are looking at growing outside of our current 3 cities. In fact, we'll have our 4th city later this year.
Oh, that's great.
Yeah,
good for you.
Excited.
More to come there. So I was scrolling through your Instagram, and I noticed you guys are fairly active in the community at various mental health fairs or community events. I'd love for you to just touch on that for a second, because it's nice that you're staying visible locally.
100%. So I think this is a hyper local business. This is not we're not a national player. We're not the real work happens in the community. And so being well known in hospitals, in emergency departments, in other mental health practitioners, and letting them know, hey, we're in Des Plaines, we're down the street, or we're in Naperville, or we're in Lakeview in the city. We have to be out there, because if you think about referring locations, if you are a psychiatrist and somebody brings up to you that they have substance use disorder, you got to really trust where you're sending that person. Putting all the sort of business aspect aside, a great healthcare practitioner is going to want to really trust. So we have people in the community going and meeting individuals, going to emergency departments, telling them about our successes. 100% we got to do that.
Okay.
Yeah.
So we're going to wrap up soon here, but I will say I'm of the belief that you can't run a business like this one without caring deeply about people, just sort of in general. I mean, that's sort of the business you're in, right? You're there to help. I mean, these are people who are suffering. And I guess if, someone were to be listening and, let's say they've reached a point where they know they need help, but they don't know what the first step to take is, what would you say to them?
So one of the mantras we have in our admission center, which is when you call any number on our website, you're going to get someone. You're not going to get somebody in some other country. You're going to get a Symetria employee, and that person is there to help you navigate. We have this mantra on our admission team, which is be helpful. And the reality is some folks come and they think, oh, well, I need inpatient. We'll go help you. We know great inpatient locations. Or, hey, you know what? I don't live close. Great. We know where to send you. So I think the helpful education aspect, I mean, our admission center reps will spend 20, 30 minutes on the phone with individuals, because we get calls from people who are year 5 of recovery and they just moved to Chicago and they're like, hey, I saw a Google review and you guys seem cool. I know what I want. This is this is where I'm at my journey. Other times we get the first call, and something like a third of our calls are from friends and family. And so a lot of what we're doing when you call isn't, it's education. It's, hey, my brother is like this. This is what I'm dealing with. I think I can get him to come. What's the appointment going to be like? What are you guys going to do when he shows up? So this work is incredibly difficult, and we've got outstanding people to help you navigate that world.
That's great.
Yeah.
You guys also have a really good website, by the way, symetriarecovery.com. It's solid.
Awesome.
It's very informative. Masroor, great to talk to you. I appreciate you being here.
Adam, it's a pleasure. Thank you.
Thanks.
Yeah.